This resource is based on research from the universities of Michigan and Columbia. The research demonstrated that the combination of good communication strategies and focused educational messages can significantly build a patient's motivation and ability to manage their asthma. This has been shown to improve outcomes in children with asthma. As a result of the intervention, children required fewer emergency department visits than control children, and they and their families were more satisfied with their medical care. The communication techniques outlined in this resource require no additional consultation time. If anything, these strategies can save you time in the long run.
Extensive studies demonstrate that people's adherence to their medical regimen is strongly linked to good communication with their doctor. 50% of our patients will not follow clinical recommendations. They either won't take their medicine, or if they do, they take it incorrectly.
So how can you increase the likelihood that patients will follow your recommendations? The answer lies in a few simple communication strategies.
In the following vignettes, we'll demonstrate ways that you can enhance your communication with your patients, helping them to become active partners in managing their illness. If you utilise these strategies each time you see a patient, you'll find that your patients are more satisfied with their medical care, more confident in their ability to manage their illness, and most importantly, will follow your recommendations more closely. The first of these communication strategies involves non-verbal attentiveness. Here's how it works.
Hello, Mrs. Travers.
Good morning.
Hi, Charlotte.
Morning.
I haven't seen you two for a while. How have you been?
Oh, fine till last Friday.
Okay, now I understand you really wanted to see me. What's the problem?
Well, it's Charlotte. She's been coughing and wheezing.
Even small gestures can set the tone for the visit and will have an impact on patients. Dr. Campbell walked in all the way, smiled, and made eye contact with Mrs. Travers and Charlotte from the first moment. All of his actions communicate to the family that he is attentive and ready to hear what both Mrs. Travers and Charlotte have to say. Notice too that Dr. Campbell positioned himself reasonably close to the family and established eye contact at an equal level, a gesture called closing the social distance. By doing this, the doctor helps the patient to feel more comfortable and at ease, making them more able to confide in the doctor. Note too that Dr. Campbell leaned slightly forward, demonstrating a genuine interest in what the patient had to say. Creating this open line of communication between doctor and patient is a critical starting point in helping the doctor make an accurate diagnosis and develop a good asthma management plan.
Well, last Friday night, Charlotte woke up in the middle of the night, wheezing and out of breath, and she said that her chest felt tight. So this kind of thing's happened before, but not as bad as it did last Friday. She couldn't even catch her breath, so we had to take her to the emergency department, and the doctor there said that she was having an asthma attack. And he prescribed some medicine for her, and then he said that we should make an appointment with our GP as soon as possible. So now she seems fine, but we don't want something like this to happen again. So, is it asthma?
Well, we'll take a look at her. Charlotte, even if it is asthma, there's no need to worry, okay? Asthma is really common in Australia, but when it's managed properly, it should not stop you from doing anything that you want to do, okay? But first of all, tell me a little bit more about what happened on that night.
Well, I woke up in the middle of the night and I was coughing and I couldn't breathe or catch my breath.
Dr. Campbell explicitly sets out to comfort Charlotte and Mrs. Travers, even before he knows what condition he's actually dealing with, by offering reassuring messages. This gives Mrs. Travers and Charlotte immediate reassurance that if Charlotte's symptoms are due to asthma, they can be controlled. Dr. Campbell follows up by identifying fears underlying the reason for the visit.
And then they sent us home.
Okay, well I can certainly understand your concern, Mrs. Travers. Now, if it is asthma that Charlotte has, with proper medication she'll be fine, but it seems that you're not convinced, are you? What else is bothering you?
Well, isn't asthma really serious? I mean, because I had a cousin who had asthma when we were kids and it just messed up his whole life. He couldn't play sport, he was always missing school.
Well, there's no denying that asthma is a serious illness, okay? But in the last couple of years, we've really learned a great deal about how to treat it. And it doesn't mean that you have to miss a lot of school, and it can mean that you can still participate in your sports, okay? Good management is the key. So if it is asthma, we're going to work on a plan together, okay, Charlotte? So it'll enable you to be able to participate in your sports and lead a really active life, okay? Now, for now, what I'd like to do is review your history, Charlotte, okay? So first of all, tell me about when the very first time this happened.
Well,
In this exchange, Dr. Campbell is responding to the family's cues before starting the history and physical examination. He offers them comfort and reassurance, understanding that an asthma attack is a very frightening experience. A certain amount of fear is productive, as it causes the patient to take his or her illness very seriously. However, research has shown that high levels of anxiety, coupled with unexpressed concerns, often make it difficult for the patient to really listen to their doctor or to fully comprehend his or her medical advice. Once a patient expresses a fear, it should be addressed immediately. Relevant reassuring messages and information can help ease the patient's fear. Often, parents hold the unexpressed fear that their child might die from their asthma. And even for this sensitive subject, a frank discussion of how remote the possibility is can be helpful.
Okay, well, from what you told me about what happened last Friday night and my examination, I do believe that Charlotte has asthma. Okay, now I want to emphasise to you both that even though asthma is a chronic illness, okay, it's very easy to manage. Now, although we don't yet have a cure for asthma, there are lots of ways in which we can control the symptoms of asthma. So the kids, just like you, Charlotte, can lead active and totally unrestricted lives. All right? So Charlotte, your asthma attack was like an early warning sign to us to do two things. Right? The first thing is we need to work out what actually sets off your asthma. And the second thing is we need to develop the right management plan for you. Okay? So Mrs. Travers, what do you know about asthma?
Oh, just what I remember from my cousin and what I read in the papers. It involves the lungs and it's on the rise.
Okay, Brian.
And it's also a kind of emotional or psychological disease, right?
No, it's not actually. What made you think that?
Well, I heard that a big part of asthma was in the head. That's why you get upset, you get asthma. I mean, my cousin did that all the time.
Well, it's true. As with any chronic illness, stress and emotional upset can actually aggravate symptoms. But asthma is still a lung disease. It's a physical condition, not an emotional one. I'll show you, for example, in this little brochure here. Okay, you can see.
Notice Dr. Campbell using a technique called interactive conversation. This technique helps elicit information from the patient while also conveying important medical information. As often as possible, he asks open-ended questions that require more than a simple yes or no response. These questions engage patients more actively, helping them to talk openly and to feel more involved. They also help generate a lot more information for Dr. Campbell to use in developing an asthma management plan with the patient. In addition, Dr. Campbell uses simple language when talking with the patient and family. Simple enough that a parent can use the same words again later when talking to other family members or teachers about what the doctor has said.
Okay, Charlotte, what we're going to do now is actually develop a management plan for you, all right? One that's just right for you. Can you help me with that?
yeah.
Okay, great. Here's what we're going to do. For now, I'd like you to take two different types of medications. The first one is called an asthma preventer. Now, you need to take this one every day, and it'll help you control your asthma. Okay? The second medication is called a reliever medication. Now, this one you only need to take when you have the symptoms of asthma. All right? So Charlotte, let's focus now on the asthma preventer. All right? It's really important that you remember to take this medication every day, in the morning and again at night. All right? So what we're going to do now is try and find a way to help you remember to take this medication. So Charlotte, can you think of something that you do every single morning that you can do at the same time as taking this medication?
Well, I brush my teeth every morning.
Okay, great. So do you think you could remember to take this medication before you brush your teeth?
Yeah.
Okay, good. So what about at night time? Do you also brush your teeth at night?
Yeah, so I should do it then as well.
Exactly. Well done, Charlotte. See, this way you'll have really good asthma control and great looking teeth. What do you think? See how you go, but I'm sure your mum and dad will be able to help you to remember.
Tailoring the regimen greatly improves adherence to the medical plan. In collaboration with the family, the doctor works out how best to fit the required doses into their daily routine. Dr. Campbell also uses both non-verbal encouragement and verbal praise to reinforce positive attitudes and behaviours. He nods approval, says good and well done when Mrs. Travers and Charlotte describe effective management strategies. Explicit encouragement and praise make the family feel positive about their interaction with the doctor. But that's not the only reason for giving this positive feedback. Research suggests that there's a link between the level of confidence people have in their own ability to handle the disease and their proper use of medications. One way they develop this confidence is by being told by an authoritative source, the doctor, that they're doing well. It's helpful to discuss both short-term and long-term goals for the patient. Let's see how this is done.
Okay, well now we want to control Charlotte's asthma so that you're not bothered by it, okay? So in the short term, Charlotte, can you think of something that you do now that you would like to do that you can't do at the moment because of your asthma?
Oh, she wakes up all the time at night wheezing and coughing. That's what I'd like to fix.
Well, how about you, Charlotte? Is that a problem for you as well?
Well, I'm always tired in the mornings.
Okay. Well, how about we work towards you getting a good night's sleep so you can be full of beans in the morning?
Yeah, that would be good.
Okay, great. So that could become your short-term goal, Charlotte. So let's say that by next week, you'll be able to sleep all the way through the night without being woken by your asthma. Would you like that?
Yeah.
Okay, great. So what about a long-term goal, Charlotte? I'm wondering how perhaps your sport is affected by your asthma.
Well, I'm really good at netball, but I'm thinking of giving it up.
Well, why is that?
Because I have to stop all the time because of coughing and wheezing.
Okay, well it sounds like sport's important to you, so how about we set a long-term goal that you can take part in sport without having to stop because of your asthma? Would that be good?
Yeah.
Okay, well let's set a long-term goal that by the next time you see me, you'll be able to play an entire game without having any trouble breathing. Okay?
Yeah, that would be great.
Okay, so to be able to reach these goals, it'd be really helpful if we develop an asthma management plan. Okay? It's a bit like a game plan so that we can actually manage the symptoms of your asthma. Okay? So I'm going to go over this really carefully with you so that both of you know what to do.
Okay.
Great.
Patients need to know the goals of the treatment plan, so Dr. Campbell helps his patients and their families create simple, concrete goals that will provide clear indications of their progress. The long-term goals help patients to see what they should anticipate down the road, that is, good asthma control. Evidence shows that patient-focused goals, rather than medically determined goals, are much more effective motivators of adherence with asthma management. Dr. Campbell helps the family with decision-making. Making decisions about asthma can be a source of great stress for family members and for other people who may be involved with the child, such as caregivers, teachers, or sports coaches. If the parent and child create a clear plan together with the doctor, there will be less tension between parent and child subsequently, and no guesswork involved by others who may care for the child.
Charlotte, my role with your asthma is a bit like a coach. Now, what I'd like you to do is to come back and see me in a few weeks and then tell me how you're going with your goals, okay? Remember, we have a short-term goal where you're going to be able to sleep all the way through the night without being woken. And then the longer-term goal is to be able to play an entire game of sport without having to stop, okay?
Okay.
Okay, great. All right, now, in the meantime, here's something for you both to read. It tells you a little bit more about asthma, and we can talk some more about it when you next visit, okay? Now, Charlotte, remember, we're partners in this, okay? So for this to be able to work, it's really important that you do your part, okay? And remember to take your medication. And then I'll do my part and make sure that we have the best management plan for you. All right?
Okay.
Do either of you have any questions?
No, I think that's quite clear. Thanks for seeing us, Doctor.
Okay, great.
See you soon.
Okay, thank you.
Dr. Campbell concludes the visit by giving the family some written educational materials, which provide more detailed information about asthma. Surprisingly, use of these communication strategies takes no extra time during the visit, but can significantly increase the family's ability and motivation to work closely with you in following their asthma management plan. I know you'll find these strategies worthwhile.
In this section, we're going to look at a series of consultations and highlight what information should be shared with patients and their families to enable them to manage their asthma better. As GPs, we only have a few minutes per visit to provide education for our patients. When used in a clear, concise and organised manner, these few minutes can be very effective in helping patients take an active role in managing their asthma. We've outlined a set of basic asthma messages which can be delivered during the course of 3 consultations. The number of visits it commonly takes to fine-tune a patient's asthma regimen. The order of these messages should be presented to suit the individual needs of the patient. The combination of good communication strategies and focused educational messages can significantly build a patient's motivation and ability to manage their asthma.
This book will help you. This is what Tom's lungs look like. You can take that if you like.
Thank you.
Within his lungs, his airways are like an inverted tree.
Can you see this?
See how the big trunk divides into 2 smaller branches which branch throughout the lungs, getting oxygen into the body. Now with asthma, 3 things happen.